Students at the UB Medical School don't just learn how to practice medicine, they also have a chance to advance research. News 4's Dr. Peter Ostro has more on UB's annual Research Day.
Dozens of UB medical students presented their research to each other and to the faculty. Some of the projects used very sophisticated scientific techniques, such as identifying a potential way to target tumor cells.
If we find that there is a key difference, like one protein that's there and not in others, then we can find out a treatment which is based off of differentiating the cells or making them not able to grow anymore.
Some used novel manipulations of clinical tests. In this project, MRI scans were used to discover whether the enlargement of a brain tumor was due to the production of new blood vessels inside the tumor.
If we can stop that growth by stopping these blood vessels from growing, then we could potentially shrink these tumors and, maybe stop the progression of this disease.
And some are aimed at improving office practice. For instance, there are several conditions that can cause a stuffy nose.
So it's different kinds of stuffy nose that can occur, different reasons that it can occur. And the treatment that we use for those patients is vastly different.
His group is developing a rapid test that can make a diagnosis.
We can just stick it in the patient's nose and maybe within a few days or maybe even immediately be able to tell whether or not what kind of stuffy nose this patient has.
While they're becoming physicians, they're also improving the practice of medicine.
It's fun when you find really nice things like this.
It's important to have the clinician perspective and also the perspective of a scientist.
For News 4, I'm Dr. Peter Ostro of the UB Medical School.